produced by Diva company, and it is intracameral injection after mostly most of the surgeries, whether cataract surgery, vitreoretinal surgery, or even glaucoma surgery, filtration surgery. This is can be given. First of all, I general talk about the all the intracameral injections, starting with the intracameral injection of anesthesia started in 1960s, and then after that a lot of things that had been developed after doing that from that time till now. So return back to the slide. And you can see that in the present, even there is an intracameral drugs that are extend the drug effect without need for repeated injections. And talking about endophthalmitis and the reduction of the rate of endophthalmitis, because in our conclusion for this lecture is that the ISCARIS study found that 5-time-fold reduction in the endophthalmitis rate of the intracameral cefuroxime. So by this way, we can see that it is the ISCARIS prove that, the American Academy of Ophthalmology recommend that, and the WHO had highlight the intracameral injection for cost effectiveness of intervention in global cataract surgery protocols. Advantage of intracameral antibiotic really it's not working on this slide. So high drug concentration at the target site, direct delivery, rapid onset of action, reduced systemic side effect, and convenient for the patient, cost effective, and that's broader antimicrobial coverage. So this is proving the efficacy of that drug. Whether it's that now I am talking today about everything in the field of cataract surgery now start to change and change. So every day there is less need for antibiotic, less need for, because of most of our surgery become phaco surgery, not like before, like there is very really there is no more chance for extracapsular cataract surgery, only in some eventful conditions. So that's why to take a lot of amount of antibiotic, like systemic antibiotic, and even subconjunctival injection of antibiotic, and then to continue on 1 month of antibiotic on after cataract. This is no more applicable. Really, we need to shorten this time of while, because we have a lot of information telling us that the endophthalmitis nowadays become much more less than before. The difference between moxifloxacin and the cefuroxime is really that the moxifloxacin, both of them are really not FDA approved, but at least the cefuroxime have the European approval, and so that's why it is much more used in Europe, while moxifloxacin are much more used in America. Both of them are for gram-positive and gram-negative, well, with the add of the anaerobic for the moxifloxacin. But what we want, really, we want to get rid of from this normal flora that's present in the eyelid of the eye. So these drugs usually they are against gram-positive and gram-negative is enough for prophylaxis in most of the cases of cataract surgery. So really, this is a very big study, and done for 4 years, 3,351. It proved that this is 1,941 cases of endophthalmitis. So the rate of endophthalmitis, not like before, because it was before there was 0.2%. Now it become 0.08% of the cases of cataract. So that's why it is without the induction of the intracameral antibiotic, still endophthalmitis nowadays is much more less than before, and most of that because of the meticulous sterilization of the eye before the cataract surgery by iodine and so on, with the improvement of the draping and all these things that lead to more clean area for the surgery. So that's why. So we are talking about the most common use of this cefuroxime in Europe, mostly used in Spain. So they found that endophthalmitis rate dropped from 0.59% to 0.039%. So this is a very, very big reduction in the amount of the endophthalmitis because of this drug. So even that, the study showed that it is, this is study done in 9 countries. There is 13,698 patient shared with it, and they found that the SCARIS study shows that, as I told you, 5-fold reduction in the endophthalmitis because of that intracameral injection. How to use it? It is just to you have a fial with 50 milligram diluted by 5 ml of normal saline, and take only 1.1 of a ml. Yeah, so this is to be injected at the end of the surgery, and it is very easily. So one vial really is enough for 500 eye, while really we are in real life we are using it for 5 eyes, and the ideal thing is to one patient, 1 vial, but this is maybe not applicable, and even the cost effectiveness is 5. So what? Since approximately 3 months, I start to replace this intracameral cefuroxime instead of the traditional subconjunctival injection, and I found that it is no need more for garamycin as an antibiotic. Garamycin is only for gram-negative bacteria, so it is not that covering all what I want, not covering the staphylococcus or streptococcus infection. And after also I found that it is very painful subconjunctival injection. We can use 1 vial for all the surgeries at that day, because of course it should not be, after preparation should not be remaining more than 8 hours. So that's why I give you 2 pictures of 2 patients. This is one of my patients, this is just 24 hours after the surgery without any subconjunctival injection. The patient much more comfortable and very, very nice. This is just a story. I give it, it's not related. Maybe, but this patient, after the cataract surgery, I prescribed for her Flowcort. And Flowcort is a drug, as you know, that is antibiotic and steroid mixture from Idol company. What happened that the patient, instead of Flowcort from the pharmacy, she take fluoromethylone. So it continued for 10 days for fluoromethylone. So this patient, after 10 days, this is her eye without any antibiotics since the intracameral cefuroxime that she take it. So I think nowadays it's come to no more need for subconjunctival infection, subconjunctival injection, and we should continue to start with less antibiotics, whether systemic should not be given, and the local one should be much less than 1 month antibiotic every 2 hours or every 4 hours. Endophthalmitis in general, it reduced, and I think with the intracameral use of antibiotic is much more now, less and less. Thank you very much for your attention. This is a reference.